Final Frontier Warriors. PCE and OCE are combining to one entry-level exam in Canada, which is going to be called Canadian Physiotherapy Examination, or CPTE. I'm right here to provide you the details on all the changes that are provided so far on the CAPR website or alliancept.org. Not just that, I'll also be explaining if there are any similarities between the previous format comparing to the new format, which is called CPT. So what's changing in 2026? It's very interesting because you have major structural changes. First and foremost, the CPTE will become a single licensure exam model, which is starting in 2026, not in 2025, which means that the traditional two-step model, the written component, which is also known as PCE now, followed by the clinical component, will be replaced by a new integrated exam, which is called CPTE. So what does this new exam look like? The CPTE will have two parts, right? Interestingly, you'll have first part, which is also called the written section, which makes up to about 40% of your total score, right? It also includes standard multiple choice questions, MCQs, and eMCQs for the first time. Most of the questions, about 80% off, will be vignette-based questions, meaning they'll present a clinical scenario just like before, and 20% will be standalone questions. The second part of the exam would be oral section. Now this is your 60% of your total score. It mainly contains case discussions, which are designed to assess how well you can apply clinical reasoning in real-world situations. Content updates. The CPTE is based on 7 domains of practice, and each is carefully weighing between the written and oral components. You can look at your screens for the detailed information, but I'm just going to give you the highlights of what exactly they are going to assess. Assessment and diagnosis, care planning, client safety and client-centered care, professional responsibilities, collaboration, communication, practice management, core clinic reasoning milestones. So it sounds very similar, right? But it also consists of some new parts, which means it's going to take care of your clinical knowledge and experience based on the client context. The content of the exam is also divided into 4 major clinical areas, just like before. Musculoskeletal, which is about 50% of your exam, neurological, which is about 20% of your exam, cardiorespiratory, which is about 15%, and other systems, which is again your 15%. Testing methods. One of the biggest changes is the introduction of the oral component, which brings a realistic simulation of clinical reasoning. Now this part carries more weight, which is about 60%, and is designed to better reflect what you'll do actually in your real life practice. Now let's talk about the similarities between the two exams so that you have some peace of mind. Both exams are based on 2017 competency profile for physiotherapists in Canada. Both use vignette-based and standalone question structures in the written component. That sounds really similar, right? You guys are really well prepared for that. Both assesses knowledge, clinical reasoning, and decision-making at the entry to practice level. Both exams ensure questions are mapped to domains and areas of practices. Both emphasize the importance of understanding practice settings, client age groups, and diversity. Both encourage active learning, time management, and of course, preparation using CAPR resources. This is a big step forward, and I know it might feel overwhelming at first, but remember, the CPTE supposedly it's designed to reflect the real world of physiotherapy more closely than ever before. So your job would be just to stay focused, prepare smartly using the blueprint, and remember, you're not alone in this journey. Let me know if you need any support. We'll be evolving into the new format very soon. But till then, good luck and follow for more details and updates.